Good afternoon, everyone, and welcome to this Phoenix Insights conversation to mark the launch of the Longer Lives Index. I'm Matt Honeycomb-Foster. I am the UK policy editor at Politico, and I also write our weekly London Influence newsletter on campaigning, think tanks, and lobbying in and around Westminster. That means I spend quite a bit of my time as a journalist talking to MPs, wonks, policy brains, and officials about some of the big long-term policy challenges that the UK faces and places where Whitehall might have a bit of a blind spot or ministers might be reluctant to act. So really interested in this index today as a way of shedding light through some actual hard data rather than guesswork on one of the big issues we face as a country. That's security and later life as we all live longer. As the report makes clear, this isn't just about kind of auto enrolment and pensions policy, though that's a big part of this too. It's much bigger, touches on everything from savings to housing to work to health to equality, all these moving parts that help determine how secure somebody feels about their financial future. So there is loads to talk about. Thankfully, we've got a fantastic panel joining us today. I should mention that this event is being recorded and you'll be able to get a replay available after the event. If you want to ask a question, please get those over to us. You can do that with the Q&A button on your Zoom screen, and I will make time for as many of those as we can at the end. If you could address them to a particular panelist, that would be great, but I'm very happy to throw them open to the floor more generally. So without further ado, to introduce our panel today, first up, we've got Kalina Kaschuk from Frontier Economics. She's going to be running us through the report's findings. She works in Frontier's strategy practice, focusing on commercial, regulatory and innovation issues. She is an expert on behavioural economics and data analysis and has a PhD in policy evaluation and agricultural economics to boot. Welcome, Kalina. And Catherine Foote is the director of Phoenix Insights. She's got decades of research and policy expertise on ageing and longevity. She's the former director of evidence at the Centre for Ageing Better, and she's held senior gigs with the King's Fund and Cancer Research UK. She's got more degrees than I've got surnames. Welcome, Catherine. Carolyn Jones is the head of Money and Pensions Policy and Strategy at the Money and Pensions Service, that's MAPS, and she's one of the UK's leading experts on pensions policy. She spent more than 25 years working in the pensions industry, including stints at British Airways Pensions, PwC and Fidelity International. Hi, Carolyn. Andrew Harrop has been the General Secretary of the Fabian Society for over a decade. He's been digging into economic and social policy challenges, as well as thinking about the future of the Labour Party. He's been in the Labour movement since the tender age of 18, and he's a member of the opposition party's Policy Commission on Work, Pensions and Equality. He's also served as Director of Policy and Public Affairs for Age UK, so he's been thinking about some of these issues for quite some time. Great to have you here, Andrew. Tony Wilson is the director at the Institute for Employment Studies. That's the major employment and human resources research and consultancy centre. He's been in senior roles at the Learning and Work Institute, and he spent his career digging into knotty issues like disability employment, pay and progression, employment skills. He's also a former senior Treasury official, so he can give us some sense of how Whitehall thinks about all of these issues. And last, but by no means least, Lord Victor Adeboye is a crossbench peer. He's co-founder of Visionable. He's a member of the Phoenix Insights Advisory Committee. He also chairs the NHS Confederation, and for almost 20 years, he led Turning Point, a social enterprise providing health and social care interventions, and he led homelessness charity Centrepoint. So he's thought a lot about some of the biggest challenges facing our society. It's great to have you here, Lord Victor. So I'm going to start off by passing over to Kalina, who's going to talk us through some of the findings from this index and shed some light on what they found.
Great. Okay, I'm unmuted. Hi, everyone. Thanks, Matt. I'm really delighted to be here today to tell you about what the Longer Lives Index is and what are the key findings you had seen from it so far. To set the scene a little bit to this, our ability to live ever longer life is a great success story and an opportunity for humans, which is enabled by medical advances and healthier lifestyles. But we are already failing to make the most of older age, with the elderly struggling with financial difficulty, isolation, and mental well-being. And while the challenges are multidimensional, at the core of this sits the issue of adequate financial preparation for retirement. And this will only get more challenging as we need to work longer or save more to support the longer lifespans we are gifted. And if we overcome the barriers to financial readiness in older age, we can turn longevity into an opportunity and help people live their longer lives more fully. So how can we do this? Firstly, we need to redefine what we mean by financial preparation in the context of increasing longevity. And secondly, we need to understand barriers and challenges people face across the various dimensions of preparation and support people in overcoming those. And we developed the Longer Lives Index with these two objectives in mind. Can I please ask for the first slide now? So in designing the index, we were very conscious of the fact that pension savings is a crowded research space. And we wanted to make sure that what the index brings is a fresh perspective on this topic. There are 4 ways in which we try to do this. Firstly, we look at a broader set of dimensions behind financial preparation, as Matt mentioned already. So we zoomed out from the traditional focus on savings to look at housing needs in later life and dimensions of work and skills, health, and family support. And I will explain shortly why all of these are important. Secondly, we explored different aspects of preparation. So our index measures confidence across various dimensions, which is a good way to take temperature of people's sentiments, compare across dimensions, and also track things over time, which is the intention for the index going forward. We also looked at people's planning through the expectations they have on various dimensions and the actual behaviors they undertake in terms of their savings. And by comparing confidence with actual saving outcomes, we can see how aware people are about their situation, which can have important policy implications. Thirdly, we focused on individual financial goals. A savings gap measured this way is a truly unique insight into retirement readiness in the UK, as most other research standardizes these goals based on adequate replacement income or savings rates. Finally, we collected a lot of data to give us a broad socio-demographic coverage of insight. Understanding social demographic differences is important, and many of those differences have been already explored well. But we wanted to be able to go deeper than that and see how intersection of social demographic characteristics impacts financial readiness. For example, with the data set we have, we can look at how expectations on home owning vary across age or by ethnicity. So this is a bit of an overview of what the survey looks like. But what did we actually find? And can we please move to the second slide now? Savings is at the core of financial readiness, and there are known challenges in the UK with many not saving enough. Our findings confirm this, showing that between 15 and 17 million individuals are not saving enough to meet their personal financial goals for retirement. Savings is also the dimension of preparation with the lowest level of confidence. Close to 18 million individuals do not feel confident about saving enough. Going back to the awareness point I flagged earlier, we find that a third of those that are under saving today are actually confident that their savings are on track. And this is a worrying result, since this group might be particularly hard to reach as they lack the self-awareness that they actually are in trouble. We also explored why people do not feel confident about saving enough, and so the reasons are multidimensional and broader than affordability alone. For example, uncertainty about how much people need to save or how best to do it is very common. But the policy debate about saving has often been too limited to trying to get people to save more through engagement, through information, and through solutions like auto-enrollment. And this is not enough to effectively address the challenge of financial readiness in the context of longer lives, where one's ability and need to save enough throughout their working life depend on a wider set of resources that people need. So what are those? I already mentioned housing, which is one of the largest costs of living, and one's housing situation is an important contribution to financial preparedness. People need to either purchase a house during their working life or save more to rent in retirement. And the amount that particularly younger people need to save to purchase a house and pay off a mortgage may be greater than what they plan to save for their pension. And while we see the housing confidence is high on average, we see stark differences in confidence levels across groups of different housing expectations in retirement. Our findings suggest that 4 in 2 currently rent, and only a third of the renters expect to buy in the future, which means that 2/3 expect to rent in their retirement. And just under 3 in 10 of those renting who expect to buy are not actually confident about being able to get a mortgage at all or to pay it off before they retire. So between those expecting to rent and those expecting to be paying off their mortgage into their retirement, we have over 13 million people, which will likely be facing high ongoing housing costs in retirement. Moving on to other dimensions, saving policy often assumes that people will continue to earn similar or growing salaries through work as they age. But this is not a given. People may not want to or be able to achieve this. So we need to rethink the linear model of education, career, and retirement if people need increasingly longer working lives. This means people's ability to upskill and reskill themselves throughout their careers is critical to increasing financial readiness. And we see that over half of people expect to retire by the age of 65, which likely is unrealistic for many, particularly for the younger people. Yet the 25 to 30-year-olds in particular expect to retire on average at that age. Over 10 million people, or 1 in 4, are not confident about being able to stay in employment or until their planned retirement age. And for a quarter of people, low confidence is driven by their perception of lack of support for older people in the workplace. Similarly, frequently, people worry their ability to find a new job. They're worried about their ability to find a new job if they need to change an employer. But the most predominant worry we see is that individuals worry about their ability to remain employed because of their health over time, both physical and mental. And good health not only means that people can enjoy older age more and face lower costs of care as they age, but health throughout one's working life is an important enabler to making a living and building a capacity to save for retirement. But 3 in 10, or close to 13 million individuals, are in poor health now, and half of them are affected by both physical and mental problems. We see that close to 6 million of those in poor health now, and another 6 million or so of those without serious current health issues, worry their health over time might impact their financial preparation for retirement. Overall, the links between health, employment, and savings for retirement come out very clearly in the index, including in the strong correlation between how confident individuals are on those 3 dimensions. Last but not least, we have support from or given to family and friends, which is common in older age and has important implications for how people should prepare financially. And this makes it our 5th dimension we studied in our research. We saw that over 7 million people expect to get financial support from family and friends in retirement, while over 9 million people expect to provide it to family and friends. These numbers highlight just how important that dimension is in financial preparation for older age. And we see an encouraging picture on how confident people feel about it, with this dimension of preparation showing higher confidence level than most others. So this is the end of my very quick whistle-stop tour to introduce the index. I know there's a lot in there, but hopefully that made you intrigued enough to read the report and explore the dashboard. Thank you, and back to Matt now.
Thanks very much for that, Kalina. There's loads to get stuck into there, so I'm looking forward to kicking off the chat. I think let's start with Catherine, and let's talk about Phoenix Insights' response to this. How are you thinking about the findings that you've gotten, and is there anything sort of in there that surprised you?
Thanks, Matt. Yes, so I suppose the basic question that this data invites us to try and answer is, how can we support more people across the UK to become more confident in their financial future? And for me, I think what the Longer Lives Index makes painfully clear is the scale of the challenge. 18 million people, these numbers that Kalina's just run through, translate to, who are not confident that they're going to be saving enough for their retirement. 10 million of us fear that we won't be able to remain in good work up until the age at which we want to retire. 7 million of us saying we're going to rely strongly on support from friends and family in later life. I think really with numbers like that, it's just clear to me that carrying on as we are just isn't going to work. And that's the hard message, isn't it? Particularly at the moment with the cost of living crisis and war in Europe and everything else dominating the headlines. I think it can feel quite hard to think about planning for the future and making the right changes now for our long-term future when there are so many pressures and uncertainties in the world for all of us today. But if we don't take action, then my fear, I suppose, is that we'll soon find that we have squandered this amazing opportunity that longer lives could give us. We've been given this extraordinary gift, haven't we, of longer lives than our parents and grandparents, longer lives than most of us think we're going to have, in fact. But we just haven't remotely tackled yet how to reshape our social structures, our society, how we think about our own lives to help us make the most of them. We've done a few important things, little things. We've banned the default retirement age. That's a start, isn't it? We've introduced auto-enrolment, of course, for some of us, though. Not if you're self-employed yet, not if you're under 22. We have got the right to request flexible working, for instance, to help us perhaps work for longer or work when we've got care and responsibilities or health conditions, but can only request it after 6 months, and you've only got the right to ask for it. Some of our city regions, like places like Greater Manchester, for instance, have made these really explicit strategic commitments to making their places great places to grow old. So there are kind of moments of hope there, but we've got to go so much further. I think really what the Longer Lives Index says to me is that the basic maths of our lives just isn't adding up. How can we support ourselves in what could be as much as 30 years of retirement from only 40 years of working? So I think there's lots that we need to do. I think we do need to support savers. We need to expand auto-enrolment. We need to make it so much easier to understand and engage in long-term savings, help people to navigate the uncertainty and the complexity we all face thinking about putting money aside for our future. But we absolutely also need to support workers. We need to support people to actually get the income they need to be able to save money on the side, to support people to enter, remain in good work with decent pay, opportunities for retraining, progression throughout their lives. So it means tackling in-work poverty. It means dealing with the prevalence of precarious jobs with very low pay, such few prospects for progression for so many of us. It means supporting people with health conditions and disabilities to find and remain in good work. And I think it means making it easier to stay and work for longer if we can and want to. So that means making workplaces much more age inclusive, reducing things like age bias in recruitment that's so rife, and getting serious about things like enabling flexible working for people. I think also that we need to support learners and career changers. Many of those we found in the index who worry about saving enough for retirement worry because they're concerned about their ability to stay employed over time. Some of that's about concerns about their health, and some of it is about concerns about their skills getting out of date. So we urgently need to see a revolution in adult education, I think, and skills provision. Ultimately, I think I'd like to see us building, new cultural norms where that kind of midlife retraining, sideways moves, career changes are feasible, they're affordable, they're normal, modelled and promoted for all of us. And I think we could do it. We've invented new phases of life before, haven't we? We invented teenagers. We invented pensioners, of course, a long time ago. So let's reinvent midlife to make it more feasible for job switchers, but obviously with a snappier title. Briefly then, just let me also touch on some of the other areas that the report does look at. It's clear that we need to address housing affordability, availability and renters' rights. If a quarter of us are going to potentially be renting in our later life, we've got to get much stronger at supporting the rights of renters to enable people to be able to afford a decent standard of living with some housing security. And that's particularly true for younger generations. And then, of course, in terms of health, none of this is going to work unless we manage to make more inroads in tackling, the fundamental structural determinants of health inequality. Health is such a critical asset in helping people achieve financial well-being, isn't it? And health trajectories of our longer lives are, of course, deeply unequal. My daughter's studying Victorian novels at the moment, and it used to be the case in this country, didn't it, that to be old was to be poor for a great many of us. And in recent decades, I think things had improved a lot, but pensioner poverty is already on the rise again. And I think what this index shows me is that we've simply failed to make the changes we need to support all of us to be able to afford 21st century life expectancies. And I think, I say again, that if we don't make these kind of big changes, I fear we might be returning to much higher rates of later life poverty in future. So that's my take on the index, and I'll leave it there, Matt. Thank you very much. Back to you.
Thanks so much, Catherine. You've absolutely thrown down the gauntlet there to basically the entirety of government, and also to employers and individuals as well. There's so much to think about. I'm always struck by we've spoken before how optimistic you are, though, about longer lives. It's not always a reason for doom and gloom, but this data allows us to be quite clear-eyed about the challenges we do face. So it's great to get stuck into it. I'm gonna bring in the panel now, and I'm going to start by talking to Carolyn. Carolyn, savings of all the dimensions covered here in this report have the lowest level of confidence. I wonder kind of what jumped out at you from the findings, and what are the potential kind of red flags we should be worrying about here?
Thanks, Matt. So firstly, I'd like to say we really welcome this report and the opportunities that the wide-reaching data set will give MAPS and others to understand the issues people are facing in their future lives, and what policymakers, industry and MAPS can best do to support people. So I think it's a really good data set to help inform those policy and those support mechanisms that need to be in place. MAPS launched its 10-year financial wellbeing strategy 2 years ago, just before COVID hit, and it has a pillar including future focus, which is a goal of 5 million more people being able to plan for and in later life. And at the time, we thought that is a really ambitious goal, 5 million more people feeling able to plan for and in later life. And I think what this data jumped out was the stark numbers that perhaps 5 million isn't enough, which scares me a little bit, because the data start 2 in 5 people not saying they're confident they'll have enough savings to meet goals in later life, which absolutely correlates to our research when we did the UK wellbeing strategy. 17 million UK adults not saving enough for retirement, and a third thinking that they are and confident but aren't on the right track. So I think from my perspective, the data is stark. And I think one of the recommendations that jumped out for me was that we really should be getting people more holistic financial guidance and getting more to people to advice at a younger age, when potentially they can do something about it. And at MAPS, our delivery plans include developing a retirement planning hub. As Catherine said, that midlife phase is so important, and we really want to push the work that has been started on midlife MOTs by industry and by the government further and out to more people, to really support them in making good choices in midlife and giving them the building blocks to plan for and in later life. And I think we can't forget either, especially post-COVID, that people, once they're retired, are no longer sitting there with a steady income. They will have income shocks, and I think COVID and the cost of living crisis has shown what a perilous state some people who've already retired could be in, and I think it's really important to understand how we can support people in being financially well beyond retirement. It's no longer a case of get to retirement and your income sorted. We need to give people actions and the facilities to remain financially well through what's going to be a very different retirement than perhaps their parents had, and a lot more complex retirement in a way. And finally, I think I'd just like to say I'd really like to thank Phoenix Insights for sharing their data. The findings in the Later Life Index in a way correlates quite closely to previous research, but I think what this data set is unique for is that it'll go further in helping us identify the subgroups within the groups of people that we can then target interventions for to help those most in need, whether they're the overconfident or the completely underconfident. It gives us that insight into subgroups to help with our targeting. So thanks, Phoenix. Back to you, Matt.
Thank you very much for that, Carolyn. I was really struck as well reading this by that kind of mismatch between the people's perceptions and the reality of their savings position at various points in their lives, and that's going to have to be something that the policymakers wrestle with. I'm going to bring in Andrew now. Andrew is an astute observer of the Westminster scene. Have the political parties been thinking about longevity in a serious way and its financial implications? And what struck you from this from this report?
Thanks, Matt. So, first of all, just echo what a brilliant data set it looks like. And I'm sure that researchers, including think tanks like the Fabian Society, will really benefit from some of the granularity in sort of that have gone into making these indexes. The things that really sort of jumped out at me, the undersaving we've just discussed, but also the findings on people expecting to be renting into retirement, and the interaction between low sort of work confidence and concerns about ill health, particularly for low income groups. And so those are sort of the three areas I really think we need to focus on massively. And in answer to your question, Matt, I don't think political parties are really thinking about this in a strategic way. You know, there's an awful lot of policy in this area, but does it all get mapped together? I realized to my horror last night that next year will be the 20th anniversary of the start of the Turner Commission, which I worked through when I was at Age UK, as you said. And it feels to me that we have not been having a really big picture conversation of the sort that the Pensions Commission had in the early 2000s for a long time. Ever since then, we've been in implementation mode. And I think that as we come up to that 20th anniversary, that's no longer enough. There are a few fundamental big drivers that sort of like sit behind all of this. The first, as Catherine said, is longer lives, which is something to celebrate and is amazing for us individually and as a society. But it means we need to smooth the resources over in our life over longer periods. We need to save more during working life, and we need to then spend it later. And when I say we, I mean us as individuals, but I also mean the state working for us collectively and the role of employers, because we cannot do this ourselves. The amount of sort of income smoothing we need to do over our lives is too big, and we need to share those risks. The other really important drivers here are health inequalities. Again, it's been mentioned, but the fact that we are not just living longer, but living unequal lengths, and some people have real risk of not being able to work sustainably even up to pension age because of their health profile, makes this area much harder to grapple with than if everyone lived to the same average age. And that has implications for in your retirement and poor quality retirements, shorter retirements, but also critically the decade or so leading up to retirement. We also have some fundamental economic problems which sort of sit over all of this. The first is the productivity crisis, the fact that wages are not increasing, have barely increased over the last 15 years. And that means that, you know, saving gets that much harder for everyone. And we have this really strange mismatch over recent years between the prosperity of pensioners and the prosperity of most people in working age. Added to that, we have growing asset inequality. And that, again, has been a real symbol of the last 15 years, where you've seen people with assets do very well and people without assets unable to build them up. And that particularly speaks to the housing side of this report, where people who are renting cannot see a way of ever becoming a homeowner. And we have this, you know, sort of huge polarization that an awful lot of people now believe they will never own a home, while there are also an awful lot of people who own two homes or more. You know, there's 2.5 million British people with more than one home, and 15 million people who never expect to own a home at all. So that's the sort of dichotomy driven by the fundamentals of our economy not working. So what do we do about it? The comments on undersaving, I think, you know, sort of need to be echoed, but I would be, coming from the centre left, a little bit more directive about what we need to do on undersaving. I'm afraid it's not good enough to say we need to have better advice and support to help people make choices. We need to put in stronger defaults and stronger mandatory elements to ensure that people are not necessarily sort of completely directed every step of the way, but basically if they do nothing, they end up in a broadly good place. And that's where the auto-enrollment principle started, but it's not enough. It needs to go in. People need to save more, they need to save earlier, and they also need particular support for self-employed people. So there's an awful lot of unfinished business on on undersaving. But it does, as this report makes clear, need to go alongside support in the end of working life, because the risks of falling out of work before people expected to or before they really need to for their financial long-term interests is really high, particularly for people on low incomes and with poor health. This has been driven by the pandemic massively, so that we've got this real spike in the number of over 50s going into economic inactivity, which we need to turn around. And that's partly a health agenda, but it's also about ensuring that work works for people with health limitations. So of course, over the long run, we want environments and behaviors to change to so that people are healthier. But there's an awful lot we can do in terms of designing jobs and the support available from government and employers for people with long-term health conditions. And then the final piece is on skills, and Catherine mentioned that. And we've been talking about improving skills, the offer and the take-up of training, particularly for some more mature adults, for decades and decades and decades, and nothing really feels like it ever changes. So we need to have a moment where we think, what will really be effective in getting significant increase in training take up by people over the age of 45 or 50. And I think that means redesigning the skills offer, because it clearly doesn't seem relevant to an awful lot of people who do need to work for another 15 or 20 years, but don't have that sort of sense of career development and a skills offer that feels relevant to them. Thank you very much.
Thanks very much, Andrew. The journalist side of me is desperately resisting trying to press you on Labour's kind of current thinking all this at the moment, but I will badge you about that another time. Let's bring in Tony here to talk about the kind of skills and employment side of things. One of the things that this report flags is there are real concerns among workers that ill health, discrimination, not having the right skills is going to mean they have to leave work earlier, and they're not going to be able to meet those financial goals for later life. Do you get the sense employers are adapting to the idea of us living longer? Where are the kind of policy gaps from your perspective, Tony?
Well, you do get that sense from the report. I think you're right, and I think actually the people who sense that and feel that are probably right to be worried, actually, because there's enough evidence about there's enough evidence from this report actually makes it clear, and also from previous survey data with older people, including work published by the ONS last month, that a significant number of people who are out of work aged over 50 have directly experienced age discrimination and age bias, and that has been a factor that may have contributed to them leaving work or struggling to get back into work. And my concern from the work that we've done with employers, my concern is that employers don't think that they have a problem. And they also don't think that older people are part of the solution, particularly when you look now, when we've got a tighter labour market now than we've ever had. We've got nearly as many vacancies as there are unemployed people. It's the tightest labour market for at least 50 years. And we've got a recruitment crisis gripping the country with more than 1 million unfilled vacancies, which is now holding back growth, could be contributing to even higher inflation. And we've seen really significant falls in labour force participation. There's 600,000 fewer people in work now than there were before the pandemic began. 4/5 of the growth in worklessness since the start of the pandemic has been amongst people aged over 50. And that's overwhelmingly been for all sorts of different reasons. It's been people leaving work rather than fewer older people joining work. It's been people leaving work, not due to retirement, actually. I mean, so about a quarter of people in their 50s who've left work say that they left due to early retirement. Most people left unexpectedly and earlier than they wanted to. But overwhelmingly, it's other factors. It's ill health, it's COVID-19, it's stress, it's their job didn't work out, their job was ended, it's furlough, it's all sorts of factors driving it. Coming back to your question, though, Matt, what do employers then do about this? Well, we have to try to support and encourage employers to understand where they may have problems, to understand their workplaces better, use better data. And of course, take advantage of, and listen to their employees and take advantage of the insights that they get from that data, and also from talking to their staff and from talking more openly, more positively about age and age diversity is an important part of how we work and what can drive employment growth in the future. I think then more practically, there's clearly a set of things we can do around recruitment. We've written about this quite a lot. better advertising of jobs, more diverse and wider advertising of jobs, standardized application forms, more diverse panels. All these things make a difference. But one of the biggest risks here is that we view these, not just here, but in other areas of potential inequality, we view this as a recruitment problem when it often isn't. It's a workplace problem. So we've done research on this looking at gender and engineering, for example. Broadening, improving recruitment practices may get more women into engineering, but unless you address the underlying cultural and workplace problems that have previously driven that low recruitment, then actually, what we're seeing is more women then leaving engineering when they get there. So we've got to be supporting retention too, and that means that's looking at aspects around job design that can make it harder for people to stay in work. So that means better induction support when people arrive in work, greater job flexibility and security. It means more notice around shifts, thinking about how you can design your work differently, where people may have health conditions, for example. It's a range of factors, actually, and a lot of this is quite specific to how we can support and work better with older people. And where there is, there's good things that we can do, and there's decent evidence about sorts of things at work. And of course, it does mean as well occupational health support, as Andrew said. We need to have better health-related support in the workplace, but that won't be enough on its own. And the final point, I think, is that we look at what would attract people back to work. For those people who have left work since the pandemic began, again, this is good sort of survey data on this. The most common reason, so most of those people are aged in their 50s want to come back or would consider coming back. And the most common reason that would bring them back would be for the social company and the contact of being at work. That got an even higher response than the money. The money came second, but social contact, and meaningful, enjoyable work, and things that for older people, just like all of us, will encourage people to come back and make work worthwhile. So I think we need to be aware. This has become kind of the ugly sister of inequalities, I fear, and we need to be much more open in talking about age and celebrating age diversity, and then trying to support employers to change their practices.
Tony, thanks very much. I'm really glad you touched on the impact of the pandemic there. We've actually had a few questions in on this that I will get to when we get to the Q&A, but there's a lot of interest on how that's changed things. I'm going to bring in Lord Victor now. This report to me kind of shows how lack of preparedness for later life interacts with just a whole host of other big public policy problems. You've spent a lot of your career trying to help people at the sharp end of some very real challenges. Is there a danger this policy conversation ends up a little bit too siloed and we just focus on one aspect? And perhaps what struck you as you were reading through this data?
Well, the key thing here is that the report, I'm always a bit nervous about these reports when they come out. And clearly, I am on the advisory committee of Phoenix Insights, and I was a bit nervous. But I'd want to start by congratulating my colleagues at Phoenix Insights, because the report is an excuse remover. It's not just a piece of intellectual noodling. There is clear rationale, clear evidence, quite shocking evidence, that not just something needs to be done, but what needs to be done in order to save millions of people from a life of penury. I'm always reminded by the sort of the five giants, squalor, want, idleness, disease, all of which could be visited upon a load of people in their older years as a result of our lack of preparedness for the majority of us having longer lives. So this is a stake in the ground, and the data that's available is an excuse remover to policymakers. To answer your question, there's always the danger that policymakers become consumed by their own tales in these discussions. I think the focus on what we need to do is probably the most useful part of reports like this, and there are clear hints in the report's recommendations. I would argue that education, it's interesting actually that we talk about education and we talk about auto-enrollment. Perhaps we ought to have an auto-enrollment for adult education at a certain age. Perhaps we ought to be more assertive about the need to surround people with opportunities for learning throughout their lives. And when we think about financial preparedness, it's across the whole life course for everyone. The report clearly points to the inverse care law in financial planning as the inverse care law in health, i.e. those who need to do it the most tend to do it the least. And those people also have a lack of credible, clear information. I always think when we talk about financial planning, that the conversation soon starts to blame the people who need it for not planning for themselves. It's a very individualistic kind of, you haven't planned your life. Actually, there are challenges to the financial services industry and to government to actually understand the nature of the people they are providing the advice to. I speak personally here, much pension information is so convoluted and so asymmetric. You need to be as qualified as most of the people on this panel to have a chance of understanding it, and even then you're in trouble. So I think we need to review the whole process of how we engage people in their financial futures from a very early age, actually, and starting with those people who are farthest from it now. A couple of things really struck me about this report. I mean, I started my career in housing, and if somebody would have told me that in London the numbers of people renting overtook the numbers of people who own their properties 5 years ago, I'd have been quite surprised. But I speak to you from a city, and I think this is repeated in cities all over the country to some degree, where the average rent's over £1,500 a month, and the average house price is £662,000. You have to think realistically about how we are providing the means by which people can have the basics, Maslow hierarchies, requirements in older age. And this is particularly made poignant right now as we're facing the biggest cost of living crisis in 50 years. So, in a nutshell, the report's an execution mover. I think it requires policymakers to really focus on what this means for large chunks of our population. And it requires us to come up with actionable interventions that need to take place now. I actually think it's a dereliction of duty, literally a dereliction of the duty of politics, to ignore this report, regardless of the party. I think it is something which we need to take very seriously if we're not going to create a generation of destitution. We're not talking a long time away. We're talking 5 to 10 years. So it's action now or action never, I think.
Thanks so much, Lord Victor. I'm going to open up to Q&A. We've had a really good bunch of questions come in on Zoom, so I'm going to try to work my way through them. This is probably one for Tony, but if anybody else wants to chip in, please do. Tim Whitaker asks, there's always a lot of talk about ageism, but over 50s really experience this in work. What more can be done? Persuading employers always seems to be the solution, but is this sufficient? So I think, how can we tackle ageism more broadly? Is the onus on employers always to do this?
Well, look, the short answer is I agree with Tim, and we come back to the same sorts of things I talked about. How we encourage firms to check their biases and to understand their data better is clearly important, and to take the sorts of steps that will make recruitment more inclusive. But actually, this is a societal sort of discussion as well. There's a clear parallel here with disability too, and a lot of older people face a kind of toxic mix of ageism and ableism in access to and experience of work. But the disability strategy that the government produced had the right sorts of principles in it. We can argue about some of the detail, but the right principles in it, with a really important strand being social change. And we have to encourage a much better quality, a more open discussion about disability and about age, and a positive story about the benefits of an age diverse workforce and society, as well as the steps that we can take to support those who are more disadvantaged. And there's not enough, I don't think, that's being led not by individual employers, but by industry bodies, by government, by social partners, by wider stakeholders in doing that. And the pandemic's a really good example. Young people were definitely hit very, very hard in the pandemic, but we all knew, or certainly I knew, I think anyone who's been through a recession knew, as soon as the pandemic hit, we would all be focused on what can we do to help young people. And now it's only really 2 years later, we're saying, crikey, this has been a crisis that has massively disproportionately hit older people. Well, what should we do about that? And I think, we have to try to encourage a better quality public conversation and celebration of age and age diversity and all its benefits.
I'll just say something about that before we move on. I think it's really important that we understand which elderly people and which young people and which, if you happen to look like me and you're young, your chances of being employed are somewhat less than if you look like the people on this panel. And I think the same goes for elderly. And I think we need to be strengthening the obligations of employers not to discriminate on full stop period, in the interests of a better economy, to be honest. And I just worry that we sort of assume that people will do the right thing just because they're asked. The evidence is that they don't. The evidence is that doesn't happen, particularly if you happen to be Black. So I just think we need to be realistic about this, as well as pointing out the benefits. We need to strengthen the rights of people not to be discriminated against and apply those rights in practice. Thank
you very, very much for that. This is a question, I think, for Catherine. Are there? It's quite a wide one, but want to get us talking. I think this is from Mike Mansfield. Are there ways to preserve intergenerational equity so that young people can look forward to a financially secure retirement?
I think that's critical, isn't it? And I think that's one of the reasons why Phoenix Insights has been established, and through this Longer Lives Index has looked at adults of all ages, of 25 and over at least. This is a question, making the most of this opportunity of longer lives, that we all need to face and all need to access those opportunities. This isn't, a problem for one particular generation. I think, so I would totally agree that I think it's absolutely critical that we look at the particular situations and challenges that different generations face and make sure that our public policy applies that intergenerational fairness lens when it's thinking about what to prioritise. I think, clearly you can see that concerns about job security and about housing in our data, and that's replicated in other previous research, are much more prevalent among younger age groups. I think we've always got to be careful, back to that earlier comment about ageism though, about oversimplifying this debate as being an issue about the old who are rich versus the young who are poor. Of course, actually, wealth inequality, income inequality of all sorts is much greater within every generation than it is between them. So I think tackling intergenerational equity is absolutely critical. But I always say when I come across people who are conflating being older with being rich, don't make that mistake. Don't say old people when what you mean is rich people.
Yeah, that's a really good point. It's very easy to use these kind of broad brush terms as we talk about this issue. This is a question from Jacinta Dillon, and I think maybe this is one perhaps for Andrew on sort of the politics and the wider political conversation around this. Is there a public campaign on changing attitudes toward old age and aging that needs to happen alongside this policy change? Should we be speaking to the public and trying to broaden this debate out beyond webinars like this?
Yeah. So I wrote a book on age discrimination about 15 years ago when the legislation outlawing it came in. And at the time, the government did run an age discrimination campaign as part of broader work on equality. And it led to age being included in the remit of the Equality and Human Rights Commission. You could ask, how much those sorts of public attitudes campaigns really filter through. Do employers really notice them? Do people, have that sense of awareness of their rights? I agree with what Victor said about the sort of general, a non-discrimination culture in workplaces, that we really need to challenge employers harder. But I think with age issues, there is another dimension, which is back to reimagining what our long lives look like. And this is the responsibility of individuals, but particularly employers, to recognize that most people will have more than one substantial career-style job over the course of their working lives. And one of the things I think is a real problem is the sense that you hire people fairly early in their life for a long-term job. And that just doesn't stack up given how long our working lives are. It's a particular problem for women because an awful lot of women who have, sort of had their kids, they're seeing them into their teens or leaving home, then want to do a big new challenge in their lives. And they find that taking on a sort of a big job, you can't get a foot in the door. And I haven't looked at the stats recently. I don't think they've changed though. Basically the peak earnings for women is in your 30s and they go down from there. For men, it's their mid 40s onwards. So we just have this, we just organize the working lives, and employers organize their sort of career structures on the assumption you come in early and you stay for 20 years. Well, then what? So we need to have the whole of our labour market designed so that people can come in the middle and then do a 20-year stint through to retirement.
This is a question I think that perhaps Lord Victor would be best placed to answer. Cynthia Cheong asks about the implications of COVID-19 and the kind of health outcomes we've seen that are unequal and disproportionate depending on where you are in society. What are the long-term impacts of the pandemic likely to be on people's health and finances?
Yeah, what the pandemic did was that it drew a red line around a fact that we already know in health, which is that we have increasing inequity in healthcare provision. Now, inequity is not the same as equality. So I think the statistic goes something like a woman in Barking and Dagenham, which is a poor part of London, has an active life expectancy, i.e. the life that they can be active, fully active, of 55. Right? In Richmond upon Thames, which is a much richer area, it's over 70. So all the pandemic did was make that worse. Right? And what it means is that we have to redesign our health policy and practice to ensure that it's equitable. I.e., if you live in Barking and Dagenham, you get the health support that you need, to prevent you from getting ill and becoming disabled early in your life, something which we are not doing sufficiently, and the pandemic made that worse. So you wrap around that the impacts of disability on your ability to work and learn, and you have a ticking time bomb. 1.5 million people have long COVID, and we haven't really addressed the consequences of long COVID. For those of you who don't know, long COVID is the ongoing symptoms of COVID beyond the initial disease, and it can really be disabling. Exhaustion, breathlessness, depression, brain fog, the whole lot. That's new, and we haven't really thought about how that impacts on people's ability to work. I mean, my view is that, and I think the report hints at this, we need to change the culture of work, full stop. And one of the things that the COVID did is that actually it brought people, millions of people, face to face with the possibility of their own death. And it made them rethink, what is work in my life? What is the value of it? What am I doing with it? And what is it doing for me? And we should embrace that, actually. And certainly the younger generation, I think, are asking the fundamental question, which is not so much how long and how hard can I work, but who am I working for and what are their values? So I think it's good news, actually. We are being forced to reevaluate work in the context of COVID, and we are being challenged to rethink population health as a result. And that does have implications for people's individual and collective finances, which government has to take seriously.
Just got time for one final question now, and this is from Fionn Travers Smith. I think this might be one that both Kalina and Carolyn can both speak to. It's about the expectation gap between what people think they're going to retire with and want to versus their trajectory based on current actions. So Fionn asks, to what extent is this gap expected to be filled through housing wealth? Do we know if that's realistic? And are there particular demographics or groups that are more susceptible to this expectation gap? Are there people who are overestimating where they're at this point in their lives? So I'll open that up to you guys to have a go at.
I'm happy to take that, Catherine, if you're happy with that. Actually, it's probably a really good question to finish this off on. I think the honest answer is that there's a lot of insight on that in the data set, which we haven't quite gotten to exploring yet. But while we were wrapping up this first publication, we already started thinking about the next steps and where we're going to go further with this. And actually, some of the questions that are being asked by Fiona are exactly the questions we're going to explore in the deep dive. So looking more about the gap between the financial goals and where people actually are with their savings and how that varies across groups, and how people might expect to close this gap. On the second question, particularly around the kind of group with the highest saving gap over 100K, what we know so far is that it's definitely not limited to young people. Actually, over half of that group are over 45. So unfortunately, a group that doesn't have much time to necessarily catch up over time, hoping they're going to increase their salaries or start saving more. But any further social demographic breakdowns of that, investigating what else is driving that, are coming next. So on that note, actually, we are currently thinking about what we're going to be deep diving on. So if anyone has any further suggestions or thoughts where we could go next, I think it'd be welcome to share that with Catherine, and we can definitely take that on board in our thinking, because we plan these 2 follow-up reports this year. So a lot more insight to come, and obviously there's a lot that's available in the dashboard that people can play around with themselves.
Excellent. Thanks so much for that. Well, we've bumped up against the clock here, but I have a feeling we could carry on talking all afternoon. The 2 best things about my job are talking to interesting people and learning new stuff, and I've managed to do that for this afternoon. So thanks so much to a really brilliant panel for teaching me things I didn't know and walking me through this fascinating report. You can read that online, and am I right in thinking that the data is being made available to interrogate and look at as well, so people can do their own digging and their own interrogation, which is always fantastic. Thanks so much to everybody who's tuned in and spent some time with us this afternoon. There's going to be plenty more from Phoenix Insights over the months to come as they dig into all this. Thank you very much. Cheers.